Hey everyone, my name is Wendy. I graduated from Miami-Dade College with my associates in nursing, and I'm currently working towards my bachelor's degree. I am a Baptist scholar and am working at Baptist Maine on a telemetry unit that has recently opened up a few step-down beds. As a nurse, I have learned so much from my everyday experiences and my curiosity in nursing and the way that things are done has only grown. As nurses, I believe we can all agree that our primary task is to be our patient's advocate, and I take that responsibility very seriously. Patients put their trust in us, and while the shift may be full of unexpected twists and turns, patient safety must be put on top of everything else. Evidence-based practice in nursing combines research with clinical experiences, but most of the time, our policies and the things we do is rarely questioned, especially as new nurses, because that's just the way things have always been done. Our discussion today is based on what our sacred cow is in nursing. So first, to define what a sacred cow is, a sacred cow is a long-held practice that is routine, even though it may not be effective. The first thing that came to my mind was SCDs, the ones that we use on our floor. Most of the patient population that I take care of on my unit are elderly patients. Sometimes our patients walk, sometimes they may need assistance, but every so often I do get a patient who is completely immobile. These patients depend on us to turn them to prevent pressure injuries, and they are complete assist patients. The reason that I mention SCDs, which are sequential compression devices, is because the main role that these devices play is in the prevention of blood clots. By their inflating and deflating motion, they improve blood flow to the legs. Now, DVT prevention is important for all patients, but when it comes to immobile patients and patients who can't express when something hurts or is uncomfortable, it poses a risk of other things. Some complications of SCDs include mild skin irritation that, if left on for too long, can cause skin breakdown. Warmth and sweating under these devices is also puts patients at risk for skin irritation and breakdown. And a major contraindication for these devices is when a DVT is already present. And if SCDs are applied too tightly, they can actually restrict blood flow, which would do the opposite of its intended use. Now, while I do believe that SCDs are extremely important to prevent DVTs, especially in immobile patients, our responsibility as nurses is not just to put the SCDs on, but to do regular checkups and make sure that we give our patients breaks from these devices to prevent any complications. We must check the fit of these devices and check the settings on them as well. I believe that SCDs are used throughout the whole hospital on many patients, and I know that it's not just on my unit, so I believe that any of my classmates may also understand the need for frequent assessments on our patients' devices. Thank you all for listening, and I hope you have a great day, and I'm excited to hear what everybody else's sacred cows are.